What I'd like to talk through today is around evidence-based care and the importance of staying up to date with current knowledge. And I've got some slides which we'll just go through, starting sort of, as it were, at the beginning. So what actually is evidence-based care? And we've got a definition in the glossary in our standards of proficiency for midwives, and that's sort of pinning it down to decision-making that integrates midwifery expertise with knowledge derived from the best available evidence. And I mean, Sue and I, and those of us who sort of are a wee bit grayer, and I have to say that because I've forgotten to do my hair dye, but anyway, I wasn't expecting to be on the platform. But what I'd like to say is that the idea around evidence-based care, now to all of us in the room, that seems absolutely common sense. Why would you provide care that wasn't evidence-based and where you weren't using the best available evidence? But it's relatively new in some senses, in that in around 1992, many of us would have been familiar with effective care in pregnancy and childbirth. And that arose out of the links to the Cochrane collaboration, which is now the Cochrane, and 30,000 volunteers from around the world who pull together the best evidence that there is on all sorts of elements of healthcare. And then also the specifics around Ian Chalmers, who responded to a call from a doctor called Archie Cochrane. And the interesting thing about presenting in Cardiff is that Archie Cochrane worked in Cardiff in the Welsh medical school. He came here in 1948 after war experience, and he was the sort of father of modern epidemiology, and he was the originator of the idea of evidence-based medicine. And he worked specifically with the community in the Rhondda, where he came up with the idea of the randomized controlled trial as a sort of way of pulling together the best evidence and that methodology behind that. And from that has grown the Cochrane collaboration. And from that we get into organizations like NICE, which covers sort of the best evidence that there is pulled together. And then the other countries of the UK have their own equivalents, like SIGN in Scotland and GAIN in Northern Ireland, although Northern Ireland now tends to also adopt the NICE guidance when they reviewed it to make sure that it's applicable within the constraints of any differences in legislation and so on. So it's really fascinating that the origins of this whole idea of evidence-based care and evidence-based medicine, evidence-based maternity care, in its own way originated in Cardiff and in the Rhondda and the area of Wales. Now, Archie Cochrane was a Scottish doctor, but his experience and what took him through evidence-based care was actually his work in Wales. So, what do we actually say about this in the code? And what we're saying in the code is always practice effectively, in line with the best available evidence, and you must make sure that evidence or advice given is evidence-based, including information relating to health or healthcare products or services, and also maintain the knowledge and skills you need for safe and effective practice. And you're all doing that in your own way today with the stands, the evidence, talking to people, finding out what's new, what evidence is emerging, and the discussions that we're having today. But I think one of the interesting things is that it does change. I remember years ago somebody saying to me, well, you know, babies and maternity and midwifery doesn't change that much. And what's really noticeable is that it has changed in ways that moved us towards much safer practice. And one of the classics was when the evidence emerged about what position you put the baby in. Because we'd been putting the baby quite happily on its front for years, and the evidence emerged that that actually was not the best way, and that we would be much safer putting babies on their back. And that arose as the evidence emerged around best practice. And that's the sort of thing that we're talking about when we're thinking about maintaining the knowledge and skills, because evidence does emerge, practice does change, and it's up to us as midwives and practitioners and registrants to be on the ball about what's new and what's changed. And In 2019, we published the Standards of Proficiency for Midwives. And in the main, initially they were used to update the curriculum, have educationalists in the universities or approved educational institutions going through the curriculum and thinking about what was in the standards and what needed to change. And it's worth saying that there was extensive work that went into the development of the standards. There were huge amounts of involvement with everybody from midwives in practice, student midwives, educationalists, researchers, and researchers from other disciplines. And the work was extremely ably coordinated through the auspices of Professor Mary Renfrew of then the University of Dundee. And Mary pulled in all her contacts, knowledge, evidence, and coordinated a thought leadership group that for over 2 years worked together to pull together the best evidence there was around midwifery in the whole, well, not just within the UK, but globally, so that we could condense it all and put it into the standards of proficiency that were needed for midwives who were practicing in the 21st century. And we consulted, and we got huge response on the consultation, lots of input from women and from interested organisations like, for example, SANS and others, who all responded back so that we were able to amend and adapt the draft standards that we sent out for publication to come up with what we published in the end as the standards. And this was to reflect the national, contemporary and international evidence, and it also took on board the evidence that emerged from various reviews and reports that had come out in the recent past. So it's all underpinned, as those of you who I'm sure, like all of us, you take the standards to bed with you and put them underneath your pillow and you can quote chapters of them. But it's all, as you know, underpinned by the framework for quality maternal and newborn care, which is based on the groundbreaking Lancet series on midwifery, which 2014 was published and absolutely raised the profile of midwifery worldwide to the extent where it's very, very obvious that get your midwifery right and you're getting things right, both for the immediate family, but in the long run for public health and for the good of the family in the long run. So it's really, really important to get the evidence right around what works, what's effective, what's safe, right from the word go. So just thinking of evidence-based examples within the standards, there's the point about continuity of carer across the whole continuum from women and newborn infants without complications, and also for those with additional needs. And that's something that there's evidence coming out that continuity is good in other disciplines as well, not just in maternity services. It's good for GPs and their patients. It's good in maternity services. It's generally good in healthcare if you have that continuity. But it's specifically underpinned by the evidence, and again, going back to Cochrane and Nice, that's in about continuity of midwifery carer. And there's also around evidence-based practice to optimise normal processes, and that's thinking about the normal processes of reproduction and health, understanding the social context in which women and families live, and that's around thinking about how you inform, and it links into that point at the bottom around providing culturally sensitive but also individualised care, because it absolutely isn't one size fits all. You have to listen and you have to tailor your care accordingly. And that includes the sort of information and the way that you give it and so on. It's also thinking about the coordinating of care, because when you're thinking about the point in the sort of social context and optimizing normal processes, there's absolutely no doubt that we all learn about normal processes of reproduction and so on, but we also always need to know when it's going awry and what to do when it's going awry. And that's when your sort of knowledge of coordinating care within the wider interdisciplinary and multi-agency teams comes in. And I would say that one of the differences that I noticed in practice between when I started out as a community midwife and when I sort of finished my time as a community midwife was the increasing knowledge that I had to have around safeguarding, because that was something that had emerged in the time period that I was a community midwife. And now it would seem extraordinary that you wouldn't be quite involved with safeguarding, particularly if you're working in a community sort of setting. So there's also all the massive amounts of research that have been done and that we need to be aware of and capable of sharing the information in an appropriate way around the importance of human milk and breastfeeding and the long-term effects positive effects on public health and well-being. So all of those are examples of where we've been able to make sure that the underpinning evidence of best care is in our standards of proficiency. But there's always the thing about how you're actually going to do this. So what we've said in the standards is about thinking about how do we start off educating students initially to demonstrate the knowledge, skills, ability to identify, critically analyse and interpret research evidence and local, national and international data and reports. Now that's actually huge, and we've actually managed to cram it into, I think, one sentence. But if you think about the elements of that, the critical analysis, the interpretation of research, that's bringing in all the expertise and the sort of graduate expectations of midwifery programs nowadays. And it's also about that use, the sharing and the applying and the lessons from data and reports. And that goes back to my point about when we were developing the standards, we pulled in the recommendations and findings that had emerged from various reports, such as Morecambe Bay at the time, which informed our standards as well as sort of strategy and policy papers and so on from the 4 countries of the UK plus international work. So it's all about informing best midwifery policy and practice and supporting evidence-based decision-making across the whole continuum of care. And that's taking you from, antenatal, interpartum and through into postnatal time. So initially, as I said, the standards of proficiency were really embraced by the education side of the midwifery house, as it were. And that was all around developing the curriculum, thinking about the assessment documents, making sure that everything was ready to go as the students started their journey through midwifery using the new standards. And while a few universities were ready to go in 2019, it's only since September this year, so September 2022, that every student in the UK who does a midwifery programme will be starting a programme that actually uses these standards. So there's a time lag between publishing and actually getting them implemented in education. And now we're in this sort of implementation and sharing and thinking about how we get the message across that the standards are actually relevant for midwives as well. Because there's the whole element at the beginning, which is about the role and practice of the midwife in the 21st century. There's the whole element around supporting and assessing and supervising students. And we've moved from the mentoring system to a system of everybody has their part to play in the supervising and the assessment of students. Because I think in the past it's been possible for some people to think, oh, yes, I really like, like working with students, I love that sort of stuff, but it also has been possible to maybe slightly dodge it. So nowadays the expectation is that everybody's involved, so everybody has to be very aware of the evidence. And that's always been the beauty of working with students, is that it's a really quick way of getting yourself up to date. But I wouldn't be telling the students that, of course. It always has been that when you're working with students, you're always learning. Just as they're learning at the time, you're always learning from them because they're coming with fresh knowledge, fresh information, and they've heard it, as it were, from their lecturers and from the people who are coming into them. So it's a great way of getting yourself updated as well. It's also very important thinking about this as a tool. So thinking about the standards of proficiency as a tool when you're in the run-up to revalidation. And I would love to be able to say that I am that sterling example of the person who doesn't wait until the very end to do their revalidation. But many of us do. If you can, my advice would be think about the content of your portfolio, as it were, and how you're going to revalidate throughout the 3 years in the build-up to your revalidation, so it's not a sort of horrible rush at the end. And I think the beauty of the standards of proficiency is that you can use them along the way when you're thinking about your appraisal, when you're thinking about what do I need to do for CPD in the next year or two, where do I need to go, are there any gaps that are now part of the expectation of students but weren't when I was working or when I was last in practice, or where I'm working now, but I'm thinking of going somewhere else, so I probably need to update on X, Y, and Z parts of what's in the standards of proficiency. So they can be a good sort of baseline for you thinking about, well, maybe I need to pick up on this bit around change management and leadership, or maybe I need to think about the full systematic examination of the newborn, or maybe I need to think about other elements that are actually in the standards. So they're worth a read on that basis alone, but they're also very, very clear about the scope and practice of the midwife in the 21st century and what the expectations of that are. And they're also, in the long run, they can be a useful tool for the development of midwifery practice in the area that you're working in, because there's an awful lot of stuff in them. And it's an opportunity to underpin possible directions of travel with what's in the standards. And as far as revalidation is concerned, it's one of the purpose of it is to demonstrate that you're continuing to meet your current standards and you're fit to stay on the register. And it's all about us sort of reflecting, reviewing, familiarising ourselves with the standards, as I've said, to make sure that you're up to date and that you're skilled in the area in which you're practicing. And it's that thing about being targeted to your scope of practice, because it's not that everybody does everything. There will be elements of the standards of proficiency that are specifically related to you and your scope of practice. And it's that, as I said, it's about using it all to think about, are there any things that you need to think about from the point of view of CPD, and also thinking about using the templates, because you can do your own thing, but there are a couple of templates that are in the on the website that can be very useful. And there's also an amalgamated document which puts them all together, which is a good sort of way to start. And I'm going to take my own advice and start doing my revalidation now and building on it for the next 3 years, so it's not a surprise when it comes up again. So what I'd maybe like you to think about and consider is just, what are your experiences of evidence-based care in midwifery practice? And are there sort of ways that you can share good practice at work? Are there ways that you think should be shared as good practice? What opportunities have you to innovate and to influence in where you're working as a midwife? So we'll have a little bit of time for some questions, and I'm sure Sue will have a few up her sleevey. But what I'd like to do is, if you do have any questions that sort of strike you after this, both Jackie's details and mine are on this final slide, and you're welcome to get in touch anytime. Thank you.